Good morning. I'm delighted to be moderating the next panel on financing and payment innovation. So I'm Hal Paz, and I'm Executive Vice President and Chief Medical Officer at Aetna. Quality of care for people with serious illness is a high priority focus area for Aetna. Our signature initiative, the Aetna Compassionate Care Program, was launched over a decade ago and has touched the lives of thousands of patients. Its origins reflect the passions of our then CEO, a geriatrician, and our current CEO, who at the time had a child in hospice care. The program identifies members with advanced illness in order to coordinate care and provide assistance and counseling with the goal of improving quality of life and providing end-of-life preference support. At the time the program started, Aetna made the decision to offer palliative care, hospice care for a full year as opposed to the last 6 months of life, and to cover it concurrently with acute care services so that a member did not have to choose one over the other. As the original data was analyzed and published, it showed that members that were in the Aetna Compassionate Care Program had significantly reduced utilization of acute care services, including ICU, med-surg, and emergency room visits, with high levels of patient satisfaction, and reduced expenditures of over $12,000 each in the last year of life on average. We recently completed a matched controlled study of this population between 2014 and 16 and found significant reductions in ED visits and inpatient acute admissions, with a 13% reduction in total medical costs. In addition, we found that members that were in the Compassionate Care Program were 36% more likely to use hospice and had a 37% longer hospice engagement than the control group did. I believe that the Aetna Compassionate Care Program is a model of how payers can provide managed care services that offer tremendous value for patients. As we move towards patient-centered personalized health, care management, number one, along with interoperability of patient-centered data and information, and finally, value-based contracting offer the opportunity to create a new way of delivering services for individuals at end of life, but frankly, I think across the entire lifespan. I'd like to introduce our panel, and then each of them will come up to the podium and present for 12.5 minutes, I think if I did my math correctly, which will give us enough time for the Q&A before our guests come in to give a keynote. So, Richard Papiel, who's Executive Vice President and Chief Medical Officer for Cambria Health Solutions. He has decades of experience in the managed care industry and chairs the National Council of Physician and Pharmacy Executives. He will address Cambria's expertise and experience in enterprise-wide palliative care approaches. Next is Jeannie Shireko, who's Vice President of Community Services for Lifetime Care, which is the largest home care and hospice organization in Western New York State. She has extensive experience in program development and design and will speak on community-based pediatric palliative care programs. David Dibon is the National Medical Director for Oncology for Anthem since June of 2017. He's practiced palliative care in the academic setting, including most recently at the Karamos Cancer Center in Detroit, Michigan. And he'll speak on financing and payment strategies for end-of-life care. Sherry Lang is Deputy Chief Medical Officer at CMS, serving in the Center for Clinical Standards and Quality. Her longstanding focus is on improving health outcomes for patients with multiple chronic conditions. She's a geriatrician and rheumatologist, and she'll discuss CMS's innovative payment models and serious illness programs. Robert Fine is the founder and clinical director of the Clinical Ethics Service and the Supportive Care Palliative Care Service at Baylor Scott & White. In 1999, he was the lead author of the Texas Advanced Directive Act, and he will describe and discuss Baylor Scott & White's value-based payment experience in serious illness care. So with that, I will turn it over to our first panelist.